Hello everybody. My name is Erin Lashnits. I'm a clinical assistant professor of small animal internal medicine at the University of Wisconsin School of Veterinary Medicine. And I'll be talking today about zoonotic diseases and our pet dogs. In terms of disclosures, I do have some research support from a pharmaceutical company, and I'm a consultant for a couple of CE companies. I am also, everyone should know, a veterinarian, not a human doctor. So this presentation is really informational, not medical advice. Hopefully I can provide an interesting perspective on these diseases that are associated with pet dogs. The objectives for this talk are 4 today. So first, we'll talk about common zoonotic diseases that are carried by and transmitted by pet dogs. Second, we'll talk about high-risk diseases that can be imported, particularly focused on international dog adoptions. And then third, we'll talk about dogs serving as sentinels for disease exposure in people. And finally, talking about steps that people can take to prevent zoonotic disease exposure or introduction of diseases from their pet dogs. To start out sort of as a broad overview, dogs are really common. This is probably not news. Everyone knows this, but people in the U.S. own a lot of dogs. There are more dogs in the U.S., more than twice as many as the human population of Canada. Okay, the human population of Canada isn't that big, but still more than twice as not many dogs in the U.S. as the human population of Canada. And over at least a half of U.S. households own at least one dog. So we know that dog ownership is really common. Dogs are really common. The human-animal bond is also really important, and the bond that people have with their dog has really huge benefits. But to come along with dog ownership, there can be zoonotic disease risks that pet owners, anybody that works with pets, and any doctors that see patients with pets, which is going to be pretty much everybody, that everybody should be aware of. These are 2 of the resources that I rely pretty heavily on for this presentation. The CDC has really useful information on basically the One Health aspects of pet ownership and what sort of zoonotic diseases, what risks are associated with dog ownership. And then there is a blog from a veterinarian up in Canada at the University of Guelph. It's called wormsandgermsblog.com. And it talks all about zoonotic disease and pet ownership. It definitely includes different kinds of pets than just dogs. You can see on there's some horses. He does talk about small mammals. But it's a really useful resource from the veterinary perspective as well. This just goes down kind of the summary of the different dog-associated zoonotic diseases that I'll cover in the next few minutes here. So starting out, we're going to talk about foodborne pathogens. Foodborne pathogens are a risk in dogs just like they are in people. This is predominantly going to be a problem when we're dealing with raw diets. The diseases or the pathogens that can affect raw diets for dogs are similar to what you would associate with people getting food poisoning. So things like Salmonella, E. coli, those kinds of things. The FDA does have a website where they list all of the recalled foods. This is for dog food too. And so you can find out about, not just E. coli in lettuce, but also in dog food and in human food that dogs are eating. Another big zoonotic disease risk from dogs is Campylobacter. Campylobacter causes diarrheal disease in dogs as well as in people. In people, we can see the most severe disease typically in young children or elderly people or people with immune compromise. There have been 2 recent outbreaks that were very specifically associated with puppies from pet stores in the past few years, but any dog can have Campylobacter. It affects their GI tract and they can get infected. And so it's something to be aware of with fecal-oral transmission. Leptospirosis is another zoonotic disease that can affect both people and dogs. So dogs can get infected from the same places that people get infected from and actually develop a really similar syndrome to what we see in people. So they're febrile, they can have acute kidney injuries, they can become icteric and have a hepatopathy from their lepto. Treated with antibiotics, doxycycline or amoxicillin, Clavamox. And the interesting thing about lepto in dogs is, so like in people, transmission is from the ingestion or mucous membrane contact of infected urine from an infected host. Now, dogs are not usually the most common source for human infection, so it's not like the dog is the most common host that people get lepto from. But it is possible if you have a dog that has lepto that if you are exposed to that infected urine, you certainly can be exposed to lepto. People can also be exposed from the same source that the dog is exposed to. So whether that's contaminated water, flooding, whatever. Fortunately for dogs, we actually have a vaccine for lepto, and it's recommended for most dogs to do annually, which should prevent and certainly prevent illness and certainly prevent severe illness from lepto in dogs. Dog bites are another sort of zoonotic disease / sort of exposure risk that we think of with dog ownership. Dog bites are actually fairly common. So 4.5 million dog bites estimated per year in the US. Some people think that this is a breed-associated problem. All of the breed associations that have been reported are probably confounded by the popularity and the use of different breeds, how dogs are treated and trained and what their sort of jobs are, and reporting bias. We know from research that breed-specific legislation, meaning like outlawing certain breeds of dogs, actually doesn't decrease the risk for bites, and certainly banning certain breeds of dogs in any given situation does not decrease the risk for bites. So all of that is to say that if you see clients that have dogs, any breed of dog can bite, and it's not like a particular type of dog is necessarily any more likely or less likely to bite just based on breed. It's more based on behavior and treatment and training and all of those things. The American Veterinary Medical Association has some really good resources on preventing dog bites. So you can check out some of these websites, and they have actually like handouts and stuff like that that talk about both, the breed associated part of it, but also sort of in general, more information about dog bites. Now, I put dog bites into the sort of infectious diseases section because we know that dog bite wounds, like don't only cause trauma, they can also become infected. So somewhere between 3 or so and up to 20% of dog bite wounds can become infected. There's a hugely long list of bacteria that can cause those infections, but really only a handful have serious disease potential. So I'll go through a couple of those. So the pathogens that we most commonly see causing serious disease with dog bites. One would be Pasteurella. About half of dog bite wound infections are Pasteurella canis, and this can cause really severe disease. It can cause cellulitis in immunocompetent people, and more severe disease in immunocompromised patients. There's been a handful of reports or common reports of dialysis line or dialysis catheter infections when dog saliva, I guess, contaminates that. And then young infants, like less than a month old, don't even need a bite. They can just have incidental contact with the Pasteurella canis in dog saliva, and that can cause infection too. Pasteurella canis has also been reported to be associated with toxic shock syndrome. So again, just pointing out that it can be really severe. It certainly is not always, but can be. Another organism that we think about with dog bites is Capnocytophaga species. Capnocytophaga are common dog oral commensals, so up to 85% of dogs have oral colonization, causes no problem for the dog, is not pathogenic in the dog, and often doesn't cause any problem in people, but rarely can cause infection from either bite wounds or from dogs licking open wounds in immunocompromised people. And this is where some of those crazy reports where they can progress to like sepsis within a day. So definitely can be very severe. There are also reports of more atypical bacteria, things like Mycoplasma and Mycobacterium species causing bite wound infections. Brucella is another organism that we have to worry about with dogs. Brucellosis coming from dogs is slightly different from the brucellosis that we think about as sort of your typical zoonotic disease that often would come from livestock. So the risk from dogs is pretty low, but the biggest risk is associated with contact with the blood or the tissues around birth of puppies. Dogs can be asymptomatic, so it's not to say that a completely healthy dog couldn't give you Brucella exposure, but it certainly can cause problems in dogs as well. So reproductive abnormalities similar to what you would see in livestock, and then also can cause chronic febrile illnesses like discospondylitis and things like that. the biggest risk is going to be with those people that have exposure to puppy births. And here you can see a map that shows the distribution of Brucella canis infected dogs and sort of the prevalence of how common it is to see Brucella in the dog population. And you can see, it's certainly not common in the US, but it is definitely reported. And, we'll talk about this a little bit when we get to the importing dogs from abroad section, but other parts of the world have a much higher prevalence of Brucella canis. So it's something to be aware of even in non-imported dogs. When we talk about vector-borne disease in dogs, we have two vectors that we mainly think about, fleas and ticks. So when it comes to fleas, this is actually an important thing to think about from the zoonotic spread side of things. Fleas carry flea-borne disease. The things we think about most would be Bartonella plague and flea-borne rickettsia. Bartonella probably has more potential to spread via fleas if there are cats in the home than just dogs. We actually don't really know what the role is of dogs and Bartonella in homes that only have dogs with no cats. But definitely these flea-borne diseases are things to think about that these fleas could be carrying. And then two, fleas that are living on your dog can bite you, and so that can cause the annoyance of the flea bite or the flea allergy dermatitis, in addition to the sort of more severe risk of the flea-borne bacterial disease that they can spread. When it comes to ticks, you might get exposed to a tick that rides in on your dog, but in most cases, you actually don't get the tick-borne disease from the dog, the same tick that's going to bite your dog. Meaning, ticks will bite once, particularly deer ticks will bite once on that host at that time, and then they're not going to bite the dog and then jump off the dog and bite you, so you're not both going to get Lyme together. Instead, what is happening is you and your dog are both going out into the same environment, and you're both getting exposed to the same infected tick populations. So it's not technically the same exact tick, and so it's not really that the dog is spreading the Lyme zoonotically to you, but rather that there's a co-exposure, right? There's a similar exposure that your dog is sharing that you're also sharing, exposed to the same time. A couple of things that I wanted to touch on that are actually pose a little bit less of a risk, but I figured I should touch on just given the current sort of infectious disease landscape out there in the world. What is the role of dogs in COVID? We know that dogs themselves are somewhat susceptible to COVID, but symptoms are usually rare. If they do develop symptoms, it's usually mild upper respiratory illness, maybe some lethargy. Generally don't get very sick from it. We also know that human-to-dog transmission in households with COVID is actually fairly common. So across a couple of different studies, about 40% of dogs in infected households seroconvert. But dog-to-dog transmission is much less likely. They have not found any evidence of dog-to-dog transmission experimentally, and it seems like probably in households this is not happening. The dogs are getting exposed from the infected people. The opposite direction, so dog-to-human transmission, also very unlikely. It seems like dogs probably just aren't shedding enough virus for a long enough time to effectively transmit back to people. Rather, people are infecting their dogs. And so because of this, dogs probably are not acting as a reservoir. They're not transmitting dog to dog. They're not sort of maintaining COVID out there in the world, but they are susceptible. So if you get COVID, your dog could get it too. They probably won't get very sick. The other sort of recent viral illness that we've all been dealing with is monkeypox. So what is the role of dogs with monkeypox, or what do you have to think about with dogs and monkeypox? There is a single case report that came out in 2022 in the Lancet that reported what seemed like human-to-dog transmission of monkeypox. It's still only just been one report. We're not really seeing this be a widespread problem, certainly not from the veterinary side. And we have no evidence that there's dog-to-human transmission. That said, there is really minimal dog surveillance. It's not something that everybody is out there looking for, but it seems like it's probably a pretty uncommon circumstance and not something that we need to be too worried about. Then finally, I'd like to tackle the worm question. So the worm question being, can I get worms from my dog? We know sort of dogs get worms. So can we be a little bit more specific about this question? Yes. We'll go through a couple of the different GI parasites that dogs get and whether they can be zoonotic or are not so likely to be zoonotic. So probably the most common worm that dogs get is a roundworm, Toxocara canis. This is a very common parasite of dogs. Over about a third of dogs in the U.S. that are less than 6 months old, so puppies, are shedding Toxocara canis eggs. And it's less common in dogs that are over a year old. As their immune system matures, they can sometimes clear their infections. We also generally regularly deworm our puppies, and so this gets to be less of a problem as they get older. But still, in endemic areas, it can be a really big problem. In terms of human disease, Toxocara canis can cause ocular, visceral, or neural larval migrans, and people get infected by ingesting eggs that are passed in the feces from dogs, from infected dogs. And these eggs can remain in the soil for really long periods of time. They're very hardy. They're very long-lived. There are very few ways to really get rid of these eggs once they're in a place. So, like, you have to pave the dirt, burn the land. Those are the ways to get rid of these things. Because of this, of course, like, the disease remains endemic in dog populations. The most common place that we see lots of Toxocara canis in dogs is in the southern parts of the U.S. And we do know that poverty is an independent risk factor for human cases of Toxocara canis, probably having to do with exposures in different ways. Toxocara canis infection in people is associated, though, with having a dog in the home, and particularly associated with having a litter of puppies in the home. And so it's much more common to see Toxocara canis in younger dogs than in older dogs. It's transmitted transplacentally. So almost all dogs are born infected, shed the eggs as they grow up, and then either get dewormed or cleared on their own, and eventually will not necessarily continue to have infection unless they're re-exposed. Hookworms are another type of worm that are fairly common in dogs. We have 2 species of hookworms in dogs in the U.S., so Ancylostoma caninum and Ancylostoma braziliense. These are also pretty common in the southeastern U.S. Dogs are generally minimally symptomatic, but the infections can be severe and even can be fatal in very young puppies. You can see melena, bloody diarrhea, weight loss, anemia, those kinds of things in young puppies. For transmission, the dogs pass larvae in the feces, and then human infection occurs when there's skin contact with the damp sand or soil containing the larva. So the human disease is cutaneous larval migrans. Though if you are unlucky enough to ingest the larvae, apparently it can also be associated with eosinophilic enteritis, so can cause more, sort of substantial illness in people. Tapeworms. When it comes to tapeworms in dogs, we also have 2 species that we regularly think about. So the first species is called Diploidium caninum. This is sort of vectored by a flea in a sense. So people can't get tapeworms from dogs directly, but the fleas will get infected and spread between dogs. And so the way that a person might get infected with a Diploidium from a dog is by accidentally ingesting an infected flea. It seems pretty unlikely that this would happen, and we do rarely see this in people, but it's a good reason to keep your dogs on year-round flea prevention. The other tapeworm that we think about in dogs are Apatococcus species. These infections occur in dogs who eat tissues from infected ruminants, so it's usually sheep or goats. This seems like it should be a pretty uncommon happening in most sort of urban or suburban dogs in the U.S., but actually there is sometimes sheep or goat meat in the raw meat-based diets, and that actually can put dogs at risk. If a dog gets infected with Echinococcus from this raw meat-based diet, they do pass the eggs and feces, and humans can be exposed to this tapeworm by fecal-oral transmission with the infected dog feces. Then there's a couple of other sort of quote-unquote worms that aren't actually worms. They're not actually sort of helminth parasites. One is what we call ringworm, dermatophytosis. This is a fungal skin disease, actually. And typically we'll see lesions in dogs that are immune compromised in some way, whether that's because of chronic illness or super high stress, like high difficult living situations like shelter environments. They have alopecic lesions, or usually these round bald lesions, often ear tips, often feet, and people can get infected with ringworm from their dogs. if you touch that area, you can get infected with ringworm. So direct contact or via fomite contact. Finally, Giardia species. The interesting thing about Giardia is that dogs do definitely get Giardia, and people also definitely get Giardia. But we now know that people get Giardia from people, and that was a funny saying that I was taught in vet school. Based on molecular phylogenetic tools, we now know that the genotypes of Giardia that commonly infect dogs actually very uncommonly infect people. People that get Giardia get people Giardia. So zoonotic infection is rare, though it is possible. So certainly if you have somebody with immunocompromised, it's something to consider. To sum up the worm question, so can I get worms from my dog? The answer is yes for roundworms, for hookworms, and like very definitively for ringworm. Ringworm would be the one I would be most worried about getting from my dog. That said, it's not technically a worm, but it's called ringworm. It is unlikely that somebody would get a tapeworm or Giardia from their dog. So now we can move on to the section on international dog adoptions. Things to consider from the zoonotic disease perspective, the infectious disease perspective, when adopting dogs internationally. There are a handful of risks. It is not a risk-free endeavor. The first risk is actually not really a disease risk, but rather that by providing a market for international trafficking of dogs, we actually might be encouraging suppliers to provide these dogs to us. And that may be sort of maintaining this pipeline of dogs from lower middle income countries with maybe not as good access to healthcare or welfare or health practices coming into the U.S. So I already have a little bit of a caveat against international adoption of dogs based on that sort of pipeline experience. But there also are some risks to consider from the disease perspective. Certainly exposure of people to zoonotic disease from sick dogs or dogs that are carrying disease is a particular concern. This is both the people adopting the dogs on, the U.S. end or the handlers going abroad to collect these dogs and bring them back to the U.S. Certainly rabies is one of the biggest concerns, and we'll talk a little bit more about rabies specifically. We know that globalization and global travel and this kind of international trafficking in dogs leads to similar risks for dog populations as it does for human populations. And so there's been international spread of infectious diseases that are not zoonotic, but that affect dogs, as well as zoonotic diseases, things like brucellosis and rabies and those things. And then there's also the concern, of course, of importing non-endemic diseases to the U.S. So diseases that really have not been seen in the U.S. or not been seen recently, newly coming into the U.S. from dogs abroad. So leishmaniasis, Chagas disease, Angiostrongylus, various others that affect dogs. And then there's also a concern amongst the veterinary population that diseases that affect livestock could actually come into the U.S. using dogs as a fomite. So foot and mouth disease and African swine fever are two diseases that are, of very, very high importance in the livestock world. And we know that dogs could be housed in environments that could be contaminated with these pathogens. Importing those contaminated dogs then to the U.S. could have a hugely catastrophic impact on U.S. livestock production. So trying to be really careful about farm exposure with dogs that are being imported, particularly for, ruminants and swine. To go into a little bit of specifics on some of these diseases, some of the zoonotic diseases that you all probably care more about as human health practitioners. So rabies. Dog rabies was eliminated in the U.S. in 2007, but it does remain fairly common in many countries. And it was eliminated by really good vaccine uptake, mandatory vaccination of dogs in the U.S. There are still a handful of human cases of rabies in the U.S. that are reported every year. Often these are from wildlife, so bats or raccoons, but occasionally it is also from travelers that get bitten or exposed by dogs abroad. There have been 2 survivors out of the 25 cases that have been seen over the past 10 or 12, 13 years now. About 30 to 60,000 people every year receive post-exposure prophylaxis, so have some significant evidence of exposure and have to get that post-exposure prophylaxis vaccination. We also know that between 2015 and 2021, which is the last report, at least 4 cases of dogs with rabies have been imported to the U.S. So it is something that does still happen. This happens because either dogs are not vaccinated or they say they've been vaccinated, but they actually haven't been vaccinated. So we have seen cases where vaccine records have been forged. So as of July of 2021, the CDC actually now bans importation of dogs from over 100 countries that have a high risk of dogs having rabies because we can't now trust the vaccination records. These 2 resources that I'll post here, this one is from the CDC, and this is the rabies status by country. So if you have a person that, is thinking about going abroad or adopting a dog from abroad, this is a good place to look to see what the risk is in that country. And this is actually just sort of a fun quiz that I came across, which is the rabies risk assessment, just from 2019. This is sort of does this person need post-exposure prophylaxis? What is the risk here? Little quiz, and I thought it was sort of interesting and fun, interactive. So moving on from rabies to leishmaniasis. Dogs are a reservoir species for leishmaniasis in the Mediterranean. As you can see from this map, leishmaniasis, visceral leishmaniasis in Southern Europe and Northern Africa is actually fairly common. We also see cutaneous leishmaniasis in Central and South America in dogs. And we know that globalization of dog adoption contributes to the spread of leishmaniasis outside of endemic areas. There have been a handful of studies looking at dogs in the U.S. That have leishmaniasis and their travel history and where they are suspected to have been exposed. And almost all of them do have travel history. The unfortunate thing about this map is that it shows the United States of America as sort of a blank. It doesn't have any information for the U.S., but we do know that leishmaniasis is endemic in certain populations of dogs in the U.S. It was introduced into the foxhound, the hunting foxhound world, I think in the 80s, and has been maintained with vertical transmission through those bloodlines. And in fact, we have had cases of dogs that don't seem to be foxhounds that have had leishmaniasis in the U.S. The transmission cycle is thought to still just be vertical at this point without vector-borne transmission here, but that may be or may in the future change with climate change and spread of endemicity of the vector. Because of this, there is a strong push for management practices regarding importation from leishmaniasis infected areas, how to manage sort of counseling about leishmaniasis from dogs coming into the U.S. to be able to still import dogs if we want to, but not move leishmaniasis into the U.S. as much as we can. So really the bottom line is that we need to be doing surveillance for dogs prior to importation, because otherwise we are going to be importing leishmaniasis into our dog populations in the U.S. Chagas disease is a little bit of a different story in that we know that Chagas disease is endemic in Texas and possibly other parts of the southern U.S. In dog populations and probably in human populations. Seroreactivity in dogs is widespread across the U.S., and that's probably just related to the commonness of dogs being imported from the southern states up north where there are fewer unowned dogs and so more of a market for adoption. So there's lots of locations where transmission may be occurring, and then dogs are being sort of moved around the states after that. Similar to leishmaniasis, the transmission cycle of Chagas in dogs in the U.S. is not completely understood. We don't have real clear indication whether there's vector-borne transmission or whether this is all related to movement of dogs. But we do know that the seroprevalence is quite high in some areas of Texas. And so there's suspicion that this is truly endemic in those areas. Moving on to one of our final sections here. So this is going to be talking about dogs as sentinels of disease in people. We know that dogs can serve as sentinels for infection of people with emerging pathogens, and this can extend across a huge variety of different types of diseases. As I was reading up on this, I actually learned a lot more about some of the different diseases that I was less aware of. So this very, very overwhelming graph shows all kinds of different infectious diseases that dogs may be serving as a sentinel for. And then the graph itself is showing the number of studies that have looked at exposure in dogs compared to people and that kind of thing. I've highlighted some of the particular emerging pathogens that I think we care most about in dogs and in people. Certainly, you can see the vector-borne diseases on the left that I've highlighted. So things like Lyme, Anaplasma ehrlichia, Rocky Mountain spotted fever. Those are probably the most common things. And this is what I always thought about, is dogs serving as sentinels for human infection with emerging vector-borne infections. Because, as I was saying before, dogs go out into the same environments that we go into, where we're exposed to ticks mainly, and they get exposed and we get exposed, and the diseases are the same. And so particularly for things like Lyme and Rocky Mountain spotted fever, they can serve as that sentinel population for where we're seeing the spread of these diseases. Something I didn't think about as much, but is definitely the case, is dogs serving as sentinels for fungal disease. Fungal disease certainly does seem to have changing endemic patterns, particularly with climate change. So things like valley fever, blastomycosis, which is something that I deal with a lot here in Wisconsin, histoplasma, other fungal diseases, dogs get just as people do, and so can also serve as sentinels. I highlighted Lashnits and Chagas disease because, again, dogs get these infections, people get these infections, and they will be getting them from the same vectors. So using dogs as a way to sort of look for whether there is autochthonous spread, whether the vector is moving through the U.S., I think is really important. And that's kind of the same idea as with the arboviruses. Dogs, like people with a lot of the arboviruses, many of them are asymptomatic. And so this is a little bit harder because we only see the very, very tip of the iceberg in terms of clinical signs when dogs get exposed to things like West Nile and things like that. But I think the situation seems to be similar in people. So again, dogs seem to be serving as a really good sentinel in that they have very similar disease when they're exposed. And all of this, I think, is important and sort of highlights the role of our pets out in the world. We know that spillover, particularly of these emerging pathogens, happens when there is sort of new and different contacts, right? And so that can involve wildlife, contacts between wildlife and people, wildlife and pets. And pets are probably more exposed to wildlife than we are, right? The dog goes out into the yard and is much more likely to play with a possum than I am. Hopefully than many people are, but maybe not. But they're going to be exposed to, anything that's in the feces of those animals a lot more. They are more likely to sort of try to interact with these small peri-urban wildlife. We know that land use change plays a role in spillover and the spread of emerging emerging infectious diseases. And, as we change forests into suburban areas or move suburban areas into sort of what used to be more wildlife-focused areas, again, like the dogs are usually at the forefront of that. They're out in the backyard running. They're out in the woods going for the hikes, running into the woods. So can definitely serve as sentinels for those exposures. And then finally, in terms of the evolution of the pathogens themselves, dogs may be acting as sort of a mixing pot in some senses. There's been some discussion of whether dogs are susceptible to high pathogenic avian flu. And so far we have not seen that, but certainly if they're in exposed areas, it could be a consideration. Similar thing to what we discussed with COVID, like are dogs serving as a reservoir? Fortunately, that does not seem to be the case, but there is certainly some concern about obviously other animal species like white-tailed deer and ferret. So all of this is just to highlight the fact that we know that dogs are out there in the world with similar exposures as people and can be sort of a red flag for when these emerging infectious diseases are moving around and are newly spilling over. This is also pointed out by the spread of the Asian longhorn tick. And so these maps just kind of show some of the spread of this tick that, we initially thought was just in New Jersey, and now it's sort of being seen all over the eastern seaboard, spreading fairly quickly, actually, based on some of the surveillance that's being done. The map on the left shows some climate modeling to look at what areas are actually best for that tick to exist in the U.S. And so, where it was imported to, or the few places that it was imported to, might not actually be its best home. And so we do sort of assume that this tick is going to spread into some of these other areas, including maybe into Wisconsin, which we have, I do not think, yet seen. I also highlighted this graph up here on the right where they actually are using dogs as sentinels for looking for Asian longhorn ticks in the U.S. So you can see the biggest bar up at the very top is ticks collected from the environment. These are researchers going out into the woods or into the fields and doing tick dragging and collecting ticks. But the next most common sample source, the next most common source of ticks that are submitted is dogs. So certainly dogs are out there collecting ticks, basically acting as tick dragging. And we can use that information to know where these novel species exist. The last section that I have is hopefully a little bit more hopeful, talking about what we can actually do. This all has been a little bit of a downer. There's a lot of zoonotic diseases. There's a lot of risk. This all sounds really horrible. Oh my gosh, why would I ever own a dog? They carry so many diseases. So what can we do? How can we prevent this? Things to think about when you yourself or when your patients are getting a new dog. Things to think about from the dog side. So we know that GI parasites, respiratory pathogens, things like cow cough and even influenza can be shared between dogs. So it's really important from the dog's health side of things that they remember to isolate or quarantine new dogs to the house for a period of time, usually a week or two is plenty, before letting them run wild, nose-to-nose contact between these two new dogs. And then even if there's not other dogs in the house, appropriately managing dog feces is really important. So picking up the poops, bagging them, throwing them in the garbage to go to the landfill, and washing your hands after you do that. Then finally, making sure that dogs are up to date on their routine preventative care before coming home is really important. And that's whether they come from a pet store, whether they come from the shelter, whether they come from abroad or domestic, getting them onto flea and tick prevention so you're not bringing fleas and ticks into your home, getting them up to date on vaccines, specifically particularly rabies, and getting them dewormed is really important before they come into the home environment. And then how can we prevent disease in people? So that is really helpful for the other dogs in the home if there are any. But some of the sort of healthy habits, the useful things that we can do to prevent disease in people. The CDC has a really nice sort of infographic about this. And actually, a lot of what's on this infographic has a lot more detail on their website. So going through this sort of one by one, little by little. Particularly associated with preventing dog bites, but also preventing inappropriate sort of contact with dog saliva, dog feces, all this sort of dirty stuff that dogs bring to the table is adult supervision. It's really important, especially with new dogs, to have good adult supervision with dogs around kids. Hand washing, of course, a mainstay of health out there in the world. Preventing dogs from licking. And this is something that I follow. I have a dog. I don't let her lick my face. It's gross. And we know that dog saliva carries lots of potentially pathogenic commensals. And that is why you sort of don't want to let them lick your face, your mouth, broken skin, wounds, that kinds of things. If it happens, it happens. It's no big deal. Wash your hands, wash your face. It should, it shouldn't be something that doesn't allow you to interact with dogs, but you don't want to encourage it or sort of train them to lick your mouth every time you come home or something like that. It's really not great health practice. Another really important component is routine veterinary care. So this I touched on the previous slide a little bit, but routine and year-round flea and tick prevention. Year-round is really important, particularly for flea preventives, because we know fleas can exist in the home all year round. And tick prevention, on a warm day in the winter, ticks might come out. And if your dog is not on a tick preventative, that's the time that they could get exposure. And so, rather than monitoring the weather and seeing if, oh gosh, is today a warm and sunny enough day that there might be a pocket of ixodes that are coming out? I don't know. Just keeping them on year round is probably an easier bet. Then routine fecals, routine deworming, particularly for puppies, but also for your adult dogs is an important mainstay of preventing any kind of worms in the house. Avoiding raw food is probably good practice for dogs. If people do want to feed more of a human food diet, just cook the meat like you would for yourself. And then, as I touched on before, feces management, so picking up the poops, throwing them away, not using them for compost or fertilizer or anything like that, and washing your hands. When it comes to importing dogs internationally, bringing them into the U.S., there are some guidelines that the CDC has put together. Certainly, this is something that your clients probably are going to want to talk to their vets about too. But this CDC website has some useful information about things to think about. And then this just highlights the sort of wide variety of options. This is certainly not every option, but a huge amount of variety and options in terms of flea and tick prevention. There's basically something for everyone now. There's pills, there's collars, there's squirt-ons, there's injections. There's so many different things that there should be an option for everyone. And so it's definitely something to remind your patients to talk to their vets about getting their pets on flea and tick prevention so they don't get exposures. There's a handful of the references that I've gone through throughout this presentation. And with that, I will close. So if anyone has questions outside of what I've presented, feel free to shoot me an email. My contact information is here and elsewhere on the website. And thank you for watching.